Welcome to the Learning Studio. You're watching our Health Sciences series, where we make medicine and health science exciting, easy, and meaningful, whether you're a student, a teacher, or just someone who loves to learn. In today's lecture, we'll explore a modern revolution in healthcare, something that connects patients and doctors without even being in the same room. Let's dive into the world of digital health and telemedicine, the future of healthcare that's already saving lives today. What is digital health and telemedicine? Imagine you're sick, but instead of waiting in a long hospital line, you open your phone, press a button, and in seconds a doctor appears on your screen, ready to help. That's telemedicine. Healthcare delivered over the internet, using smartphones, computers, or tablets. Now add apps that track your heart rate, smart watches that detect when you're falling, or computer systems that help doctors diagnose diseases faster. That's digital health. Together, they form a powerful new field that uses technology to make healthcare faster, smarter, and more accessible, especially in places where doctors are far away. What do students learn in this field? Students studying digital health and telemedicine learn about both medicine and technology. Some exciting topics include teleconsultation, how doctors treat patients using video calls, remote monitoring, using smart devices to track heartbeats, blood pressure, or oxygen levels, mobile health, mHealth, health apps for managing diabetes, mental health, or pregnancy, electronic health records, digital files that store your complete medical history, artificial intelligence, AI, helping doctors read x-rays, predict diseases, or recommend treatments, cybersecurity in healthcare, protecting patient information online, health chatbots, AI-powered assistants that answer your medical questions 24/7, virtual reality VR in medicine, helping train surgeons or reduce pain in patients, digital inclusion, making sure rural areas and underserved populations can also access care. It's a mix of healthcare, engineering, data, and ethics, a true 21st century skill set. Real-life example, saving a life in the mountains. Let's say an old man in a remote village high in the mountains begins having chest pain. There's no hospital nearby, but his daughter has a smartphone. She opens a health app and connects instantly to a cardiologist in a city hospital. The doctor listens, asks questions, checks the man's vitals through a smartwatch, and quickly diagnoses a mild heart attack. An ambulance is dispatched, and the man is stabilized before anything worse happens. No hospital visit, no delay, just technology and care working together. How this is used in real hospitals and research. In hospitals, doctors use tablets during rounds to check your medical records. Telespecialists offer advice to small clinics without local experts. Nurses monitor patients remotely, reducing crowding in emergency rooms. Mental health therapists talk to patients from the comfort of their homes. In research, scientists use big data from digital tools to study disease patterns. New digital platforms help test AI-driven diagnostics. Developers build health apps that are now used by millions of people worldwide. This field is fast, growing, and full of innovation, transforming how care is delivered. Why this knowledge is the foundation of future medicine. The world is changing. People want care that is safe, fast, private, and available anywhere. Digital health and telemedicine help reach people in villages, war zones, or during disasters, cut costs and waiting times. Use data and AI to prevent illness before it begins. Empower patients to manage their own health. It's not just a backup plan, it's becoming the main highway for global health. So if you love both technology and medicine, this is your playground. You could be designing the next app that detects heart attacks or building systems that connect every patient to the care they deserve. Thanks for joining us at the Learning Studio. Make sure to subscribe and follow the Health Sciences series because the future of medicine is already here and you can be part of it.